Question: what are the common causes of bowel injury? Answer: bowel injury can occur due to blunt or penetrating trauma, surgical procedures, inflammation, ischemia, or infections affecting the gastrointestinal tract. Question: what are the clinical signs and symptoms of bowel injury? Answer: clinical signs of bowel injury may include abdominal pain, tenderness, distension, guarding, rebound tenderness, vomiting, nausea, and signs of peritonitis such as fever and tachycardia. Question: how can bowel injury be assessed during a physical examination? Answer: during a physical examination, signs such as localized abdominal tenderness, guarding, rebound tenderness, and percussion dullness may indicate bowel injury. A thorough examination is crucial for detecting signs of peritoneal irritation. Question: what imaging studies are commonly used to diagnose bowel injury? Answer: imaging studies such as abdominal X-rays, computed tomography CT scans with contrast, and ultrasound can help diagnose bowel injury, visualize abnormalities, and determine the extent of damage. Question: what is the management approach for a stable patient with suspected bowel injury? Answer: in a stable patient with suspected bowel injury, non-operative management may be considered, including observation, fluid resuscitation, and antibiotics. Close monitoring is essential to detect signs of worsening or complications. Question: what is the primary concern in managing bowel injury? Answer: the primary concern in managing bowel injury is preventing contamination of the peritoneal cavity and controlling infection. Prompt surgical intervention is often required to repair the damaged bowel. Question: how does the management approach differ between small bowel and large bowel injuries? Answer: small bowel injuries are often managed with primary repair or resection and anastomosis, while large bowel injuries may require diverting colostomy and delayed primary anastomosis to reduce the risk of anastomotic leakage. Question: what is the significance of fecal contamination in bowel injuries? Answer: fecal contamination increases the risk of peritonitis, sepsis, and wound infections. Contaminated areas need thorough irrigation and debridement during surgical repair. Question: how are bowel injuries managed in cases of penetrating trauma? Answer: in cases of penetrating trauma, surgical exploration is often necessary to assess the extent of injury, repair the damaged bowel, and address associated injuries. Question: what is the purpose of nasogastric tube placement in bowel injury management? Answer: nasogastric tube placement helps decompress the stomach, prevent bowel distension, and reduce the risk of aspiration during surgery for bowel injury. Question: how can the risk of anastomotic leakage be minimized in bowel injury repair? Answer: the risk of anastomotic leakage can be minimized by ensuring adequate blood supply to the anastomosis, proper surgical technique, use of well-vascularized tissue, and creating tension-free anastomoses. Question: what are the potential complications of bowel injury and its surgical repair? Answer: complications of bowel injury and its surgical repair include infection, abscess formation, anastomotic leakage, bowel obstruction, and adhesion formation.
Question: what is the role of antibiotics in managing bowel injury? Answer: antibiotics are used to prevent infection and peritonitis in patients with bowel injury. They are often administered intravenously before and after surgery. Question: how is bowel injury managed in patients with underlying medical conditions? Answer: bowel injury management in patients with underlying medical conditions requires a comprehensive approach that considers the patient's overall health, medications, and potential impact on wound healing and infection risk. Question: what is the significance of retroperitoneal bowel injuries? Answer: retroperitoneal bowel injuries are less common, but can lead to delayed diagnosis due to a lack of typical signs. Close monitoring and a high index of suspicion are important for timely intervention. Question: what is the seatbelt sign and how does it relate to bowel injury? Answer: the seatbelt sign refers to a bruise or abrasion across the abdomen following a seatbelt injury. It may indicate underlying bowel injury or other abdominal injuries. Question: what are the indications for exploratory laparotomy in suspected bowel injury? Answer. Indications for exploratory laparotomy in suspected bowel injury include signs of peritonitis, hemodynamic instability, evisceration, or significant mechanism of injury. Question. How is a colostomy performed, and when might it be necessary in bowel injury repair? Answer. A colostomy involves diverting a portion of the colon to the abdominal surface. It may be necessary in cases of extensive bowel injury, contamination, or anastomotic problems to allow the injured bowel to heal. Question. What is the significance of the two-layer closure technique in bowel injury repair? Answer. The two-layer closure technique involves suturing the seromuscular layer followed by the mucosal layer separately during bowel repair. This technique reduces the risk of leakage at the anastomotic site. Question. What is the role of enteral nutrition in the management of patients with bowel injury? Answer. Enteral nutrition may be initiated early to promote wound healing and prevent ileus in patients with bowel injury. It helps maintain gut function and reduces the risk of bacterial translocation. Question. How can intra-abdominal abscesses be managed following bowel injury repair? Answer. Intra-abdominal abscesses following bowel injury repair may require drainage, antibiotics, and close monitoring. Interventional radiology techniques can be used for percutaneous drainage. Question. What is the hollow viscous injury rule in assessing bowel injury? Answer. The hollow viscous injury rule helps identify patients at low risk of significant bowel injury based on specific clinical and laboratory criteria, potentially guiding the need for further diagnostic tests. Question. What is the role of diagnostic peritoneal lavage (DPL) in assessing bowel injury? Answer. Diagnostic peritoneal lavage (DPL) may be used to detect intraperitoneal bleeding or injury. However, its use has declined with the availability of more sensitive imaging modalities. Question. How is the choice of suture material determined for bowel injury repair? Answer. The choice of suture material for bowel injury repair depends on factors such as tissue type, tension, and location. Absorbable sutures are often preferred for the mucosal layer to minimize foreign body reaction. Question. What is the role of laparoscopy in diagnosing and repairing bowel injuries? Answer. Laparoscopy allows direct visualization of the abdominal cavity, facilitating diagnosis and repair of bowel injuries. It is especially useful for identifying injuries in patients with equivocal physical examination. Findings. Question. What is the diastolic mnemonic used in assessing abdominal trauma, including bowel injury? Answer. The diastolic mnemonic helps guide the assessment of abdominal trauma. D. Distracting injuries. I. Injury mechanism. A. Abdominal pain. S. Seatbelt sign. T. Tenderness. O. Obvious injury. L. Lap belt mark. I. Impaired consciousness. C. Clinical examination findings. Question. How does bowel injury repair differ in cases of iatrogenic injury during surgery? Answer. Iatrogenic bowel injury repair often requires meticulous examination, accurate identification of the injured segment. Question. What is the role of tension-free anastomosis in bowel injury repair? Answer. Tension-free anastomosis involves ensuring there is no undue tension on the suture line during anastomosis to reduce the risk of anastomotic leakage. Question. How can the risk of adhesion formation be minimized after bowel injury repair? Answer. The risk of adhesion formation after bowel injury repair can be minimized by gentle tissue handling, thorough irrigation, minimal dissection, and avoiding unnecessary foreign bodies. Question. How can patients be educated to recognize signs of bowel injury complications? Answer. Patients should be educated to recognize signs of infection, wound problems, bowel obstruction, or recurrence of symptoms after bowel injury repair. They should seek medical attention promptly if such signs occur. Question. What is the role of multidisciplinary collaboration in managing bowel injury patients? Answer. Multidisciplinary collaboration involving surgeons, intensivists, infectious disease specialists, and nutritionists is crucial for optimizing the management of patients with bowel injury. Question. What is the catcher's mitt sign, and how does it relate to bowel injury? Answer. The catcher's mitt sign refers to localized bowel dilatation and narrowing due to extrinsic compression from adhesions or scars. It may indicate a previous injury or abdominal surgery. Question. how does bowel injury repair differ between children and adults? Answer, bowel injury repair in children often aims to preserve bowel length. Avoid stoma creation whenever possible and consider the child's growth potential and future bowel function. Question, what is the role of fecal diversion in managing complex bowel injuries? Answer, fecal diversion, such as colostomy or ileostomy, may be performed to allow the injured bowel to heal without the constant passage of stool, reducing the risk of anastomotic leakage. Question, how can the risk of bowel injury be prevented during surgery? Answer, careful surgical technique, gentle tissue handling, meticulous dissection, and proper visualization are key to preventing bowel injury during surgical procedures. Question, how is the decision made between primary repair and resection anastomosis in bowel injury? Answer, the decision between primary repair and resection anastomosis in bowel injury depends on factors such as the extent of injury, tissue viability, contamination, and the patient's overall condition. Question, what is the role of post-operative wound care in managing bowel injury repair? Answer, proper wound care, including appropriate dressings, sterile technique, and monitoring for signs of infection, is essential to prevent wound-related complications after bowel injury repair. Question, how does early mobilization benefit patients recovering from bowel injury repair? Answer, early mobilization after bowel injury repair helps prevent complications such as pneumonia, deep vein thrombosis, and ileus, and promotes faster recovery and return to normal bowel function. Question, what is the significance of serosal tear in bowel injury? Answer, serosal tears in bowel injury can lead to leakage of bowel contents into the peritoneal cavity, increasing the risk of contamination and infection. Question, what is the management approach for bowel injury patients with suspected mesenteric injury? Answer, bowel injury patients with suspected mesenteric injury require immediate surgical exploration to assess the extent of bowel and vascular involvement and to restore blood supply if necessary. Question, how is the risk of bowel injury evaluated in patients with blunt abdominal trauma? Answer, the risk of bowel injury in patients with blunt abdominal trauma can be evaluated based on clinical examination findings, imaging studies, mechanism of injury, and associated injuries. Question, what is the role of peritoneal lavage in diagnosing bowel injury? Answer, peritoneal lavage may be used as a diagnostic tool in cases of suspected bowel injury, allowing detection of blood, bile, or feces in the peritoneal fluid. Question, how can the risk of bowel injury during laparoscopic surgery be minimized? Answer, the risk of bowel injury during laparoscopic surgery can be minimized by proper trocar placement, visualization, gentle manipulation, and adherence to established laparoscopic principles. Question, how is bowel injury managed in the context of polytrauma? Answer, in polytrauma patients, a systematic approach to assessing and managing all injuries, including bowel injury, is essential. Priority is given to the most life-threatening injuries. Question, what is the role of percutaneous drainage in managing intra-abdominal abscesses after bowel injury repair? Answer, percutaneous drainage can be used to manage intra-abdominal abscesses following bowel injury repair, providing a less invasive alternative to surgical intervention. Question, what is the role of wound vacuum-assisted closure VAC in managing complicated bowel injury wounds? Answer, wound vacuum-assisted closure VAC therapy can be used to promote wound healing, reduce infection risk, and manage complex bowel injury wounds with compromised tissue viability. Question, how does the management of bowel injury differ in patients with pre-existing bowel conditions? Answer, patients with pre-existing bowel conditions may require tailored management to account for factors such as tissue fragility, altered blood supply, and potential complications related to their condition. Question, how is bowel injury managed in patients with compromised immune systems? Answer, patients with compromised immune systems require careful management of bowel injury, including aggressive infection prevention strategies and tailored antibiotic regimens. Question, what is the role of fibrin glue in bowel injury repair? Answer: fibrin glue can be used as an adjunct to reinforce bowel anastomosis, seal small defects, and reduce the risk of anastomotic leakage. Question: how can bowel ischemia be differentiated from non-ischemic injury? Answer: bowel ischemia may present with severe pain, bloody stools, and signs of systemic inflammation. Prompt diagnosis and surgical intervention are crucial to salvage ischemic bowel segments.